How do you choose between using Retin A or using a retinol? Well, I have got the answers for you in this video. My name is Dr. Anthony Youn, and I'm known as America's holistic plastic surgeon. I help health-conscious women over 30 look and feel their best by teaching them a holistic approach to health and beauty. And today we're going to cover this question I get from so many people. Dr. Youn, how do I choose what to use? Should I use Retin A or should I use retinol? Well, that is the problem that we're focusing on. How do you choose between these two? Well, Retin A, you may know, or tretinoin, is a prescription strength retinoid. Both of these are retinoids. They're derivatives of vitamin A. And Retin A, or tretinoin, is the stronger version, the one that you have to get via a prescription or through a doctor's office. Retinol is a bit of a weaker form. It's an over-the-counter version of it. And this is what is in pretty much the vast majority of commercially available skincare lines have retinol in at least one of their products. So how do you choose between which of these is for you? Well, let's start by looking at the benefits of Retin A. Retin A has been shown in scientific studies to exfoliate the skin, to smooth fine lines, to fade age spots, to thicken the dermis or the deeper layer of the skin, to tighten the skin, and, crazy, even to reverse early pre-skin cancers. So this one cream, this tretinoin, can do a lot for your skin. Okay, and so if I had to pick one aggressive anti-aging cream, then that pretty much is it, tretinoin. But what are the drawbacks of applying a tretinoin cream like this one that you get in a doctor's office? Well, it is much stronger than typically the retinols, and you can get a reaction from it. I'll tell you a story. I had first used Retin A when I was in medical school and I was having some acne issues. So my family doc prescribed it to me. This is 0.05%, but they make 0.1%, which is double this strength. And she wrote a prescription. She said, Tony, just go ahead and apply this every day and your skin will look better. So I applied it to my skin every day religiously for a week, and then my face was on fire. It was bright red, it was flaking, it felt like I had a mask of fire on my face. And it took 2 weeks for it to completely settle down. So the thing with tretinoin is it can create an acute inflammatory reaction. And the interesting thing is you get this acute inflammation that will eventually subside, okay, it will go away, and in the end, Retin A reduces chronic inflammation. So it's kind of odd, but you get this initial reaction that subsides in most people, and most people can tolerate it afterwards. But going through that reaction can be fairly traumatic for some. Another drawback of Retin A is that you need a prescription. This isn't something that you can just go to your drugstore or your Sephora or department store and pick up. Okay, this is something you got to get through a doctor's office in one way or another. Retin A can also dry the skin. This is something that for some people isn't much of an issue. If you've got thick, oily skin, Retin A a lot of times does really well for skin like yours. But if you've got skin like mine, or if you've got thin skin, if you've got sensitive skin, if you've got very mature skin, if you're a woman who's past menopause, sometimes it's hard for the skin to tolerate it because it really dries. And because it's typically put in fairly kind of generic formulations, it often doesn't have all that nice of a feel to the skin. It doesn't feel soft and silky and glamorous on your skin because it's more of a medical grade cream. Okay, and so for these reasons, especially how strong it is, it's not necessarily for everybody. Well, what about retinol? What are the benefits of retinol? Well, it exfoliates the skin, it smooths fine lines, it fades age spots, it thickens the dermis, and it tightens the skin, which is everything that we've said about Retin A or tretinoin. And it might reverse early pre-skin cancers. And I put a question mark after that because the studies that show the reversal of pre-skin cancers are typically done with a tretinoin, not with a retinol. This is my YOUN Beauty Retinol Moisturizer. It's our top selling product in my natural and organic skincare line. Okay, so retinol basically does the same things as Retin A, it just isn't quite as aggressive. It may not be quite as effective at it, or as Retin A. So what are the drawbacks then for retinol? Well, it's not as aggressive, so the changes are probably going to be slower than what you see with tretinoin. and your insurance isn't going to pay for it. Okay, some people get prescriptions for this tretinoin, the Retin A, and their insurance actually pays for it. Well, you can't write a prescription for retinol because it's just not a prescription product. And it may not help with skin cancer. So if you have a history of skin cancer, especially on your face, I encourage you, look for a tretinoin, get a prescription, talk with your dermatologist about that. That's going to potentially help prevent new ones from coming about in the future. Not sure that a retinol cream will do that. Retinol really is more purely anti-aging over the tretinoin. So what are my recommendations as a holistic plastic surgeon? Well, I recommend that you start with a retinol first. If you've not tried these before, go with the retinol. This is my YOUN Beauty Retinol Moisturizer. This is made with natural and organic ingredients. We have it for sale at my online store. There's a link below. There's also a lot of skincare companies. Most of them have their own version of a retinol moisturizer. So you can look for them in the drugstore or in the department store. So start with that, see what you think, okay? If you have been using it for a few weeks to a few months and you're just not seeing much, you're not getting much flaking or exfoliation, then it's possible that your skin needs something stronger. If that's the case, then go ahead and look for a doctor who can get you on some Retin A. If you have a skin cancer history, I would probably go with the Retin A over the retinol, just because better to be stronger, better to be safe than sorry with this type of a thing. So if you don't like any of these as well, then you also have the option of growth factor or peptide. So some people, doesn't matter whether it's a retinol moisturizer or whether it's a Retin A or tretinoin, their skin just doesn't like it. They get a lot of flaking, they get dryness, it doesn't work for them. If that's the case, then go after the growth factor or peptide-based creams. A lot of creams are out there that have these ingredients that are proven anti-aging ingredients. I don't know that they're quite as effective as the retinoids, but they definitely can help your skin. So I hope this was helpful for you. We've got a lot more great information. Subscribe, comment, and like on this video, and check out these other ones for some great anti-aging stuff for you.